Hello, my name is Dr. Matthew Bosner, and in our COVID world, we wear masks when we have all interactions with individuals, but for the purposes of our discussion today, I'm going to take my mask off and meet with you for several minutes discussing the important topic of atrial fibrillation. I'd like to welcome you all to the Women's Health Fair 2022, and we always like to have interaction and discussion with the participants concerning important health topics. The health topic this year we have chosen is atrial fibrillation. Atrial fibrillation is the most important abnormality of cardiac function that we see in practice. And that will be not only for cardiologists, but also for your mid-level providers as well as your primary care doctors. Atrial fibrillation is an irregular rhythm of the heart system. The heart is a pump, as demonstrated here, and the top part of the heart, which is the atria, are responsible for getting blood back to the body, and then the blood moves down to the ventricle, which is the lower chamber, main pumping chamber to the heart, and then out to the body. To work in an efficient system, as the heart is a pump, it needs to beat in synchrony, which means the top part of the heart needs to beat, and then the bottom part of the heart needs to beat. Atrial fibrillation is a condition where the top part of the heart, the atrium, beats in an irregular manner. It wiggles instead of beats in a nice, smooth fashion. Eventually, some of the blood will get to the lower pumping chamber of the heart, but it's the irregularity of the heart beating which causes the abnormality. Now, atrial fibrillation is a very common disorder. It increases with age. It's relatively uncommon in individuals under the age of 50, but increases in frequency and clinical presentation as we get older. When individuals reach the age of 75 to 80, 8 to 10% of individuals, that means 8 to 10 out of every 100 individuals, will experience atrial fibrillation at least one time in their life. And atrial fibrillation causes several conditions, and that's why it's important to make the diagnosis. If the heart is not beating in a smooth fashion and regular fashion, you may have symptoms of tiredness, fatigue, lightheadedness, dizziness, or even stroke. And stroke we will come to in more detail in a few minutes. And the reason we are concerned about this is we want to make you feel better. So having a slower heart rate, as long as the heart rate is not beating greater than 110 beats per minute, will make you feel better. So that's one of the treatment options that we'll discuss in several minutes. So the goal of in our evaluation and treatment of atrial fibrillation is to make the diagnosis and to see if there are underlying conditions which may cause the atrial fibrillation, and to get you to feel better, and most importantly, to prevent stroke in the future. Atrial fibrillation is the most common underlying cause of stroke in individuals over the age of 60. When we look at the heart, in the top chambers called the atria, in the top part of the heart, there are nooks and crannies of little muscle tissue, and blood, as it goes through the heart, it can get caught in those nooks and crannies. And these blood clots which occur in the heart can break off and go to different parts of the body. It can go to the brain, and that's what causes a stroke. It can go to the arm, the leg, or your abdomen. And that's why treating atrial fibrillation with blood thinners, as we'll discuss in the treatment phase, is very, very important. We can determine your risk for a cardiac event in the subsequent 10 years by using what we call a risk calculator. And this is available to all your providers on their smartphone or on the internet, and they could tell you what your stroke risk is. And stroke risk relates to age, if you're a male or female, if you have underlying conditions such as high blood pressure, you've had a previous heart condition such as a heart attack, a bypass surgery, a heart stent, or even stents in your legs, that puts you at higher risk. And the most important risk for a subsequent stroke is if you've had a previous stroke. So we can determine that and tell you if your stroke risk is 0, or your stroke risk is 1%, or 2%, or 5%. So let's talk about diagnosis and treatment. So if you have symptoms and you come to your doctor with those symptoms I described earlier, dizziness, lightheadedness, heart fluttering, shortness of breath, they will do an examination and check an electrocardiogram. They may also check an electrocardiogram as part of your regular physical examination program, and in particular if they feel that your heart rhythm is irregular on examination. And they will subsequently order a 12-lead EKG in the hospital or in the clinic and make that evaluation. However, there is new technology available to us today which has greatly expanded our ability to make the diagnosis, and this can be done even at home. We all commonly have smartwatches which can record EKGs and rhythms, but an excellent way of determining this is a tool that we call mobile telemetry. So to make the diagnosis of atrial fibrillation, you will have an evaluation from your provider, examination, and a EKG that is done in the office or the hospital. Another excellent way of making the diagnosis is using your smartwatch or a mobile device to make the diagnosis. One mobile device that's available is called the Cardio Mobile EKG system, and it sets up with your smartphone. This took me about 2 minutes to set up when I received my device, and you open it up and you take out the little machine which is predetermined and sync with your phone, and all you do is put your 2 fingers on the pads, and as you can see, you get an excellent EKG. This EKG represents a regular rhythm with normal electrical activity and no evidence of atrial fibrillation. So these devices, you can save the EKG and you can email or get it sent directly to your provider. So it's an excellent tool if you have symptoms, intermittent atrial fibrillation, or concerns from your provider that you may have atrial fibrillation. So in summary, I would first like to thank you all for coming and participating in our Women's Health Fair 2022. I wanted to demonstrate to you the importance of atrial fibrillation, making the diagnosis, especially as we get older, our stroke risk increases significantly, and we will talk to our providers about making the diagnosis and implementing a treatment plan, which may include heart rate control with medications, possible procedures to eliminate the atrial fibrillation, and chronic surveillance, which is following your atrial fibrillation that may come and go on your smartwatch or other technology such as the Cardio mobile device. Thank you very much again, and have a great day.